cancer.
People who are getting diagnosed with colorectal cancer are getting younger and younger. And mind you, colorectal cancer is a disease of those who are already in their latter
It
years in
should
their
be
life.
for it's a old
Old people's
cancer.
disease. Yes. Okay. Usually, people with colorectal cancer are already past their middle age, and now we are beginning to see patients who are in their middle age and even younger
The
who get
statistics are
diagnosed.
very interesting. The next one says that the incidence rate dropped by 2% each year in adults older than 50 years old. So there's literally a shift from an old person's disease is starting to become a
Younger and
middle-aged
younger. Yes.
person's disease.
Yes. You know why?
Hi, welcome to Simply Healed again, and today me and Dr. Jansen are back here together. Hi, Doc.
Hello, Shan. Hello, everyone. Happy to be here again with you.
Today we're going to talk about one of the most common cancers that are occurring today, which is colon cancer. And we're just going to give a little bit more in-depth discussion about what colon cancer is, what it looks like for those of you who don't have colon cancer, and how can you elevate your chance of survival. So tonight is a pretty on-the-spot topic focusing on colon cancer, but don't worry. At the end of our very short discussion, which is about 15 to 20 minutes, we will be opening the floor to ask me anything. And you can ask anything, right? Even if you want to ask what's Dr. Jansen's favorite Korean dish, right? Yeah, you can. But more importantly, you can ask about any other illnesses that you have, other types of cancer, and questions related to that. So, Doc, colon cancer, take it away. Tell us about colon cancer.
Now, first, let me show you what a colonoscopy looks like. Okay?
It looks pretty good. I mean, it looks clean. This is what a healthy colon looks like.
This is what your colon looks like when
Not
the doctor
disgusting
shows
at all, you know. I usually
Yes,
don't
yes.
like to look inside the human body,
So,
but this looks good.
Yeah, so there should be, it should look like this. This is what normal looks like. Now, the next slide is what colon cancer looks like. Now, this one is a fungating mass, actually with a lot of mucus. To some degree, it also has some pus already. Okay? So, this is quite a big tumor inside the colon. Okay? So, this is what colorectal cancer looks like. Okay? Now, for a little bit of statistics, colon cancer is quite common. It's the third most diagnosed cancer globally. From 2014 through 2018, the incidence actually rose by 1.5% each year for adults younger than 50.
So that means people are getting younger and younger,
Yes.
getting cancer.
People who are getting diagnosed with colorectal cancer are getting younger and younger. And mind you, colorectal cancer is a disease of those who are already in their latter
It
years in
should
their
be
life.
for it's an old people's cancer.
disease. Yes. Okay. Usually, people with colorectal cancer are already past their middle age, and now we are beginning to see patients who are in their middle age and even younger.
The
who get
statistics are
diagnosed.
very interesting. The next one says that the incidence rate dropped by 2% each year in adults older than 50 years old. So there's literally a shift from an old person's disease is starting to become a
Younger and
middle-aged
younger. Yes.
person's disease.
Yes. You know why? As
What?
you get older,
Yes.
you change your lifestyle. You change the food that you eat. to a
That's
healthier
true.
diet.
Number one, your appetite
become-
isn't that good, and you are more aware that you might. I mean, you're
Yes.
going back to heaven
You-
soon, so you take care of yourself.
Yes, people just tend to take care of themselves more better, or they eat food which are a lot healthier. So people tend to become more health conscious when they get older. All right, so yeah, so that's
Something
a few
on a more
statistics.
serious note, it's actually the second
Second
leading cause of death in cancer. So
Yeah.
colorectal cancer is one of the major causes for cancer deaths.
Now, let's go to the signs and symptoms of colorectal cancer. Now, the signs and symptoms, as you have read here, are quite non-specific.
Yeah,
Okay?
it's pretty much. It could be anything.
It could be anything.
So don't give
Yes.
yourself a cancer scare.
Yes.
All right.
Okay.
Yeah.
Now, how do you know that what you are feeling already might already be cancer?
That's
So
important.
it should be a myriad of these signs and symptoms.
That means
Okay?
a combination, not just one.
Okay. So let's say, for example, you are quite constipated, and then when you poop, there's blood. the amount of stool that you are
That's coming
excreting
out.
is pencil-like, so it's like a pencil thing.
Very thin.
Very
It's
thin.
because remember the picture you saw in front. There's an obstruction in your colon, so
Yes.
it's like
pushed
push
through. So that's one of the reasons. And then, of course, you'll have unexplained weight loss, and then you have a family history of colorectal cancer or any other cancer for that matter. Then you begin to consider, what I'm feeling right now might be cancer. So that should prompt a consultation already, especially if you have blood in your stool.
That's always a no-no.
Okay.
Whether or not it's cancer or not, it's time to go and see a doctor so that whatever is troubling you will be addressed. It's not good to have blood in your stool.
Okay. Now, of course, these signs and symptoms, like what I have just mentioned, like the family history, should be interpreted according to risk factors as well, because these signs and symptoms can mean anything. Okay. So let's go to the risk factors. So what are the risk factors for developing colorectal cancer? So these are the risk factors. But let me show you the more notable ones, like chronic inflammatory bowel disease, and especially a low fiber and a high fat diet.
Yeah, Doc, we look at the list. It's quite obvious that nobody needs to be told that if you live a sedentary life, that means you just sit and watch Netflix all day. You're not going to be healthy. And those who smoke and drink alcohol, you know yourself, right? So what I do think, like what Doc you highlighted, is those of us who try to be healthy, we may need some advice on like where to focus our efforts. And it seems here for colorectal cancer, focus your effort on more fiber intake.
Yes.
All right.
Okay.
So if you take more fiber, that will definitely help.
All right. So here are the things that you should do in order for you to be able to reduce your risk of developing colorectal cancer. So let me emphasize a plant-based diet, just like what Shan said. Okay? So fruits, vegetables, whole grains, and legumes are still the mainstay. Why? Because of the fiber. Now, fiber. Why is fiber so important?
Yeah, that's
it's always...
And it's not just cancer. It's got to do with mental health.
Yes.
Everything.
Everything. It has something to do with your gut microbiome.
Mm.
People or humans cannot digest fiber.
Yes.
Okay? We cannot break down fiber. Only the gut bacteria inside your colon can break down fiber. And when the gut bacteria digests the fiber that you have just ate, it produces short-chain fatty acids like butyrate, which have the anti-cancer properties, which also increases serotonin. It has a big influence on the neurotransmitters that is secreted by your brain. Makes you feel better overall.
Well, you said a magic word, right? You said an anti-cancer. What is that? Anti-cancer nutrient. And here we are looking to see the latest supplement, looking for the latest anti-cancer substance when our own body makes anti-cancer substance. And you know, right, whatever your body makes is probably designed for you, right? Because it's something about, and all you needed to create this anti-cancer nutrient in your body is fiber. So I hope that helps. So let it be an encouragement to all of us to go more plant-based, and if you eat plants and fruits, take the high fibrous ones, because your body is actually going to use it and produce anti-cancer substances.
Okay, so that's for the diet. Now let's go for the screening.
Okay,
How do we diagnose?
Because age, right?
Yes.
You talk about age. And what age should we know to go for screening?
Okay.
So, why is screening important first?
Alright, screening is very important because colon cancer is curable if detected early.
There you go, everyone. Cancer is very treatable if you detect it early.
Okay, let me show you the
How
data.
treatable?
Okay, this is the prognosis. Colon cancer is curable if found early. That's why screening is very important. Now, let me show you the overall survival rate of colorectal cancer. So, combining all stages, all types of colorectal cancer, that is 65%. Okay, so this means that 65 out of 100 colorectal cancer patients live after 5 years. Okay? Now, of course, this is combining everyone, right? Now, let's focus on the early stage. The localized stage is 91%. So, 91 out of 100 people who get diagnosed colorectal cancer very early on and get treated survive after 5 years.
So it's a sure bet.
It's a sure bet.
It's a sure bet. That
You
if-
live, right?
So screening becomes a very important strategy, guys.
If you get diagnosed with colorectal cancer stage 4 on the outright, okay, then your chances of survival significantly goes down to 15%. Okay, so at what age should you be screened for colorectal cancer? So at 50 years of age. Okay, so this is for individuals who have no family history of colorectal cancer at all. So like me, in my family, we do not have any relatives, family members who develop colorectal cancer. So me, I have to undergo colonoscopy at 50 years of age.
Okay, that'll be for me in 2 years' time.
If you have a family history of colorectal cancer, so let's say for example, your dad, your grandfather died of colorectal cancer, then you should get colonoscopy 10 years earlier than the age when the immediate family member got diagnosed with cancer. So let's say for example, your grandfather got diagnosed with colorectal cancer at
55.
55 years old. So you should get colonoscopy at 45 years old. So that's how we go about it. Now, once you get diagnosed with colorectal cancer, what are the other laboratory tests that we should get? Number 1 is CEA. So that CEA, or carcinoembryonic antigen, is the biomarker for colorectal cancer. Now, CEA is quite non-specific as well, but more often than not, it tends to get it becomes increased with colorectal cancer. Okay, so this is what oncos use. Now, CEA, just using CEA alone should not be used as a screening tool. Okay.
Okay, that's good advice. No, CA not a screening tool.
Okay, it's not a screening tool because there are a lot of factors that can increase it. All right. Now, CEA should be used in the context of the diagnosis of colorectal cancer and use it as a treatment response marker.
That means every time you go for your chemotherapy and everything, you want to know
Yes.
how well it's working.
It's
you look at the
working.
CEA.
Is it going down? All right. So once, okay. So let's say for example, you are someone with colorectal cancer. You are a candidate for surgery. Now, before you undergo surgery, you should get your CEA tested. Okay. Then once you have finished surgery, your CEA should again be tested
to see if the
to see if
surgery
it went
has
down.
improved.
Yes, to see if the surgery really removed all of the tumor. Okay, now that is the use of cancer biomarkers. Okay, like CEA. Next is imaging. So we have to stage your cancer. So depending on the stage, the appropriate treatments would be recommended. But more often than not, if you have stage 1 colorectal cancer, best to have it removed, number 1. And number 2, you have to still go for chemotherapy to be sure. Okay? So, what are the treatment modalities that you would expect if you have a colorectal cancer? So, mainstay is still surgery. Okay? So, if you are someone who is trying to seek an onco, let me refer you to my good doctor friend, Dr. Jimmy Katapia. So, Dr. Jimmy Katapia is a surgical oncologist who, manages a lot of colorectal cancer patients. My goodness, and he's actually quite good.
It's very good, actually.
Yeah.
And I think it's very important here. I mean, if you are here in our locality, we can refer you to our doctors. But maybe, one day, Doc, we have to do an episode on how to choose the right doctor as well. I think this is it. Find a doctor that would take the time to explain to you what conditions you are in. And I really, really think as patients, we have the right to ask questions. Why? Because whatever the doctor does, whether it's successful or not successful, we are the ones that feel the pain or feel the joy or feel the treatment, the healing or the sickness. So if you're the one experiencing all the outcomes, I think you have the right to ask the person what's happening to you and why is he doing this to you. So that's my advice, so that you can find doctors that will explain to you, so that you can make your decisions not out of fear and not out of ignorance. You make a decision knowing how to do something on your own as well, to whatever the doctor is doing to you. If you understand what he's doing, you can do other things to work in concert, right, to make his treatment even better, and then you will avoid doing things that will clash with his treatment. So that's how I would choose doctors. So Dr. Katapia, Dr. Jimmy is one of those oncological surgeons who understand nutrition, the importance of nutrition, the importance of strengthening the patient between chemotherapy and after surgery. So he will then work with doctors like Dr. Jansen. So that's what you want to find when you assemble your own doctor team when you are treating cancer. So Doc, how would you treat colon cancer?
Again, it's multifaceted. So I approach colorectal cancer in multiple ways. Okay, so number one is to remove the headquarters of the tumor. Okay, if you remove the headquarters, then the tumor burden significantly goes down because the headquarters is not there anymore. Okay, so what we need to, after removing the tumor, what we need to worry about are the microscopic tumors and the recurrence now. So it's one less thing to worry about. So surgery, again, is the mainstay. Number two, natural treatment. Very important. You have to have a high fiber diet. Okay, and not only that, you have
so the natural treatment we're talking about is not like something complicated like lingzi or some Chinese concoction, right?
No.
So the natural treatment is as simple as taking more
fiber. Eat more fruits, vegetables, whole grains, and legumes. Now, the question is, which of the fruits and vegetables should you be eating? Now, you have to go for a consult. Okay, so I can give you the list. All right? Now, next is chemotherapy. You have to remove all the microscopic cancer cells, okay, circulating around your body. So this chemotherapy, the purpose of it is to reduce the recurrence of the cancer. If the cancer does not come back, then it becomes clinically insignificant. It becomes insignificant to your body because it's so small, right? Why would you worry about something so small, right? So if it's not causing you any symptoms, then there's nothing to worry about, okay?
So again, for everyone, this is not an endorsement of chemotherapy without reservation. We are very well aware of the many side effects of chemotherapy and that patients can actually die from chemotherapy instead of cancer. So it's not that we're ignoring that, but why are we so confident to tell you to look into chemotherapy is because we have protocols, we have extracts that can protect you from the negative side effects of chemotherapy. Hence, you should really look at the benefits of chemotherapy because you don't have to worry so much about the side effects. Just have a consult with Dr. Jansen, you'll be able to manage all the side effects. Again, refer to our YouTube specifically on this topic, and that will open up the options.
Chemotherapy, yes, the benefit would, kill the cancer cells. But of course, how about the healthy cells?
It does hurt it.
Yeah, it will hurt your body, yes. But is there a way wherein we can mitigate that side effect? Protect the bone marrow, protect your immune system, protect the integrity of your body? Yes. Okay? Now, chemotherapy is given in cycles. Why is it given in cycles? It's order for your body to rest.
To recover.
Yeah, to recover. Now, the problem is some patients cannot recover fast enough to receive the next cycle. So
all patients are doing nothing
to
recover.
To recover
in between.
Yeah, in between. Okay, or to recover fast enough to receive the next cycle. My goal for our patients receiving chemotherapy, it's to allow your body to recover faster in order for you to receive the next cycle. Okay, and how do I do that? Food, Simply Nature PPARs. Okay?
And the end result is red blood cell counts and white blood cell counts remain high.
Remain high.
And that's a very important indicator to your onco.
Right? So next is radiation therapy. But radiation therapy is only reserved for rectal cancer. Okay? Because the bowel is continuously moving. Right? So if you are going to undergo radiation therapy, the target should not be moving. Okay? So radiation therapy is only reserved for rectal cancer because the rectum is fixed. Okay,
got it.
Next is immunotherapy. Like the Starlimab. So
this is very exciting. I saw the news when it came out.
Yes,
I think it came out in this year.
This year, a few months ago. I think 2 months ago. Yeah, the news about a new drug or new drug therapy for colorectal cancer.
A specific type of colorectal cancer?
Only for colorectal cancer. Actually, dostarlimab is being used for other types of cancer already. Now, colorectal cancer is a new one. Okay, so they tried using dostarlimab for colorectal cancer, and lo and behold, all patients was cured of colorectal
Early
cancer.
stages?
No, these are advanced. These are recurrence. So, there you go. These are some of the treatment modalities that you can opt for if you develop colorectal cancer. But please mind you, if it is indicated, please go for it. Okay, if your onco advises you to go for it, please do so. And don't forget to, don't forget the natural treatment. Of course, we have to address the root cause, still the root cause, okay? So, in the approach for cancer treatment, okay, it's not just important to remove the tumors, or it's not just important to remove the old branches or the rotten branches. It's also very important to nurture the tree so that there won't be any more rotten branches. So nurture your body. So that's why natural treatment is also very important here. Okay?
So even though we have dostalimet, you still will need to do some adjustments in terms of supplementation, lifestyle adjustments, dietary awareness on what to eat and what not to eat, so that you can live, you can choose better, live a quality life, and be 100% treated. Our PPAS extract, and not the PPAR agonist, all right? It's actually in the extract itself. So it's not the PPAR agonist, the extract itself. There are components in the combination of phytonutrients and agonists that we are able to promote or increase dendritic cell activity. Dendritic cell activity is the one that actually detects cancer. So one reason why Dr. Jansen's patients who use our protocol is able to see good results with cancer is because your own immune system is actually properly aiming and hitting the right target, right? Because it can detect cancer. So I thought it would seem that with dostalimet and increased dendritic cell activity,
that will work.
Yeah, because not only do you remove the cloaking device, you also make sure your targeting mechanism, your immune system is shooting straight, right?
Yes.
Then
again, it works well together.
Works
so
well.
Sometimes, I experience that, especially when I combine PPAR agonists with chemotherapy. I advise patients to also take PPAR agonists, especially when they're undergoing chemotherapy. My purpose was to mitigate the side effects, but somehow the oncos, hey, your tumors are responding well. There are a lot of shrinkages.
So the treatment works even better because
it works even better. Now we can stop your chemo. Don't have to finish all 8. We can just stop at 6.
So
sometimes we get through.
So again, we say this so often in our program. Don't just go for one approach to cancer. Cancer has to be approached in many angles. If your onco doesn't say that, then let me tell you, even your onco uses many angles. You know why? The chemotherapy drugs that you use, they're seldom, not never, but they're seldom used in isolation. It's often always a cocktail of chemotherapy drugs. So even an onco actually attacks cancer from
different angles.
Yes. We actually have a program on how chemotherapy drugs work on different angles. So search on it on YouTube. And we hope that, I'm going to steal Dr. Jansen's line right now. I hope that you learned a lot today. All right? And that your increased understanding will help you make the right choices in combining different approaches to treating cancer. So don't do it blindly, do it with understanding. And if you have questions, you don't understand clearly, just ask us as we move to our Ask Me Anything. Any last words before we start answering questions?
Nothing anymore for me. I see already a lot of questions coming up on the screen.
And I stole his line, so I hope you learned a lot today.
Let's get to it.
Let's get to it.